My name is Kelsey Lewis, and I'm a urogynecologist here at TriHealth. I see patients for all types of pelvic health disorders, starting with the bladder, including things like overactive bladder, urgency, frequency, feeling like you have to use the bathroom all the time, and then stress incontinence, which is leaking urine with laugh, cough, sneeze, those situations. And we can treat those non-surgically or surgically. We have discussions with the patients and offer all treatment options. And then, of course, we take care of things like pelvic organ prolapse, which again is a disorder of the muscle and connective tissue and results in prolapse of the pelvic organs. So again, we have non-surgical and surgical options for that. Our surgical options are all minimally invasive. Most of what we do can all be done vaginally with no incisions on the abdomen. It allows patients to regain confidence in themselves. And my goal as a urogynecologist is to make sure that patients don't think that their issues are just considered a normal part of aging. We are really bringing to light some of these issues and advocating for patients to take control of their pelvic health. I think the most important role for me as a urogynecologist is to make sure that I listen to my patients. I feel very strongly that the decision-making process is a team effort. So I really like to lay out all the treatment options for the patient, have a discussion, and then allow them to, tell me what they would like to do. I take a very individualized approach to patient care, and I want every patient to leave feeling like, their main issues were addressed at this visit and we're doing the best thing for them. The second thing I really like to prioritize is just maintaining an open and non-judgmental space for patients. I want them to be confident in sharing information that they've maybe never talked to anyone else in their life about. I think it's important that they feel heard and respected. There's lots of satisfying things about my job, but I think probably the most satisfying for me is when a patient comes in and you can tell they're really nervous and they don't really want to talk about these bothersome issues, but then as the visit progresses, they feel more and more comfortable. And by the end of the visit, they tell me, wow, I had no idea all these treatment options were available. Thank you for making me feel comfortable. And then they leave with information and, they feel like someone listened and took care of them, and then they can come back and we can proceed with the treatment that they choose.